Hi, I'm Micah Shalansky, and welcome to another episode in FEHB's Federal Fact Check. Today I want to answer a question I got about Medicare. Now, Medicare is something that affects every single one of us, and eventually we're going to get on Medicare, but the question is when. Now, Medicare is different than Medicaid, right? Medicare is a system like Medicare Part A that more than likely you're presently paying into. Some amount is withheld from your current pay, and at 65 we go under this Medicare program. Now, you still need to keep FEHB, but that's a whole different video. We'll talk about how those two correlate. And then there's this other thing called Medicaid, which we're not going to talk about. Medicare happens at 65 generally. Medicaid is poverty. So they're kind of two different systems. So we're going to be focusing on Medicare. So the first question is, when do you need to enroll in Medicare? And I'm going to talk about Medicare Part A and Part B. Well, Medicare Part A is pretty simple. Regardless of your employment, you can enroll at age 65 in Medicare Part A, which is the hospital coverage. Doesn't generally cost anything in order to enroll in Medicare Part A. You already paid for it your entire working career. 1.45% of your pay was withheld, plus that same amount from your employer was withheld while you were working, and so Medicare Part A is paid up. But you have this thing called Medicare Part B, which is what I like to say is quasi-optional. You don't have to sign up, you just kind of have to sign up. And so that's what we're going to be talking about, is when do you need to sign up for that? And you have an open enrollment time that you can sign up for Medicare Part B, as in Bravo. The first one is at your 65th birthday. That's when you can enroll, and you can enroll up to 3 months before your 61st birthday, the month of your 65th birthday, or 3 months after your 65th birthday. And if you enroll within this time period, there's no penalty which is imposed, and that's really, really important. So when are you turning 65? You got 3 months before, the month of, and 3 months after. So 3 plus 1 plus 3, 7 months. You have a 7-month enrollment window that you can sign up for Medicare. It's generally fairly easy to sign up for it. You can go to medicare.gov most of the time. You'll be able to sign in or create an account if you don't have one, and then be able to sign up for Medicare Part A and Part B. Now, like most government things, if you fail to follow directions, it comes with a penalty. If you miss the open enrollment, which is the 3 months before your 65th birthday, the month of, or 3 months after, there is a 10% per year penalty for every year you do not enroll in Medicare Part B. Now, it's 10% of the Medicare premium. So let's just say for discussion, the Medicare premium is $160 a month. Well, then that means you're going to have to pay 10% of that every month additional for every year you didn't enroll. So it can get kind of steep if you don't enroll in Medicare Part B. So you really need to look at it. Now, like with most things, there's always an exception, right? One of the exceptions is while you're working. So if you're still working as a federal employee at the age of 65 and you have FEHB as your primary insurance, then you do not need to enroll in Medicare Part B. You have an exemption. You actually have an 8-month exemption. You have the month you retire up to 8 months after the fact. All right, it's not really to scale, but we have 8 months, including the month that you retired, to enroll in Medicare Part B after you separate from service, and there's no penalty imposed. So let's say you retired on December 31st is your retirement day. Well, then the next year you'd have 8 months to enroll in Medicare Part B, and there would be no penalty. You do have to show that you were covered under active insurance. So you can do that by getting a letter from your HR. I like to do this before you separate, actually get proof of coverage. You can also do it after you separate, but it just takes a little bit more time. So this is a really nice exemption that's out there. Another great exemption that's out there is if you have insurance from your spouse, that is their active employment insurance, health insurance, you can be delayed in signing up for Medicare Part B. So here's an example of how that works. Let's say that I'm the federal employee and I'm 65 years young. My wife is also a federal employee and she is 59 years young, right? So there's that age difference that's there. Well, I'm 65, I'm supposed to sign up for Medicare, and let's just say I'm retired. But if I am on her FEHB plan which, by the way, if I'm on her plan, it's tax deductible, because one of the things with FEHB is while you're paying it while you're employed is a tax deductible benefit. When you get it when you're retired, it is a taxable benefit. You got to pay taxes on that premium that you pay every month to FEHB. So if I was a spouse or a +1 on my wife's plan, the rules for Medicare state that if you're actively covered by health insurance with an active employer, which my wife is actively employed, I'm covered by her FEHB insurance, I do not have to sign up for Medicare until 6 months after she retires. So let's say she's gonna work till 65. Well, then that means if I'm 6 years older, at 71, I need to go sign up for Medicare Part B. And there's no penalty for me to sign up because I was covered under her active insurance. Now I have to show proof of that again when I go to apply. So these are some great rules to really know and understand, so when it affects you, you know when to sign up for Medicare Part B. A little tricky one to throw out there, for those that had military service or are gonna have TRICARE insurance, please note TRICARE normally requires you to sign up for Medicare at 65, period. So it doesn't matter if you're covered under FEHB, your TRICARE says you have to sign up for Medicare at 65 regardless of employment. So there's always a little bit of difference in rules. So these are just some guidelines that you can know to help get better educated on your federal benefits. So I hope this information was benefit. As always, if you have any questions, you have anything you want us to cover, make sure you put that in a post below so that we can get it and hopefully answer your question on the first federal fact check. Until next time, happy planning.